Hello everyone, my name is Dr. Castillo. Welcome to the channel. Let's get started. Today I'm going to take you behind the scenes of what it is to have a bunion surgery and hammertoe surgery. But before we do that, you gotta understand what a bunion is and a hammertoe is, right? So a bunion normally is a bump right here on the side of the first metatarsal, and then the hammertoes normally are these deformities here on these toes, right? Toes 2 to 5 are normally the ones that are hammered. Sometimes the big toe could also become hammered, but normally are these guys, okay? Now, before you undergo surgery, obviously a doctor is going to give you a full evaluation, and then consider what surgery will be better suited for your deformity, right? Okay, now that we discussed this, let's just dig in a little bit more into what it is that I'm talking about. So my referral to surgery, what I mean is actually to do minimal invasive surgery, right? It's a innovative technique, takes years to practice, and it's something that I want to show you guys, and so you can see what it is to actually have a surgery based on minimal invasive surgery. Okay, so let's get started. So here we're gonna basically mark the incision where we're gonna make a osteotomy on the big toe, right? So we're using the C-arm to see where we're gonna make that osteotomy, at which point I mark it with a marking pen. As you could tell there, that's what I'm doing, I'm marking it. Now we're also gonna make a small incision on the top of the first metatarsal, where that small incision here, right, using the 67 blade to basically file down some of that extra bone prominence that we have on that bunion, right? So we're going to shake that down, we're going to file that down. Next, now we're using our bone burr right into that dorsal incision, which is the top, and as you can tell, I'm using a bit of up and down hand motion, and I'm filing down some of that medial eminence. Okay, so we're flushing out all the bone paste that's left over. Now this is a new incision to poke the side of the toe, where we're gonna now make an osteotomy. We're gonna make a cut on the first metatarsal. Okay, so we're using the bone burr right now, going through. We're gonna make a what we call is a pilot hole, right? So let's make the pilot hole. Through that hole, we're gonna make an osteotomy, plantarly and dorsally. As you can tell here, we're making the osteotomy. See, that's the plantar cut now. We're going down, doing the plantar cut. Okay, now we're gonna then go back into that same pilot hole and then make a dorsal cut of the bone. Okay, here, the patient's bone quality was very strong, right? So it took us a while to make the cut, but I don't know if you noticed that I'm using some syringe, right? That syringe is just saline, sterile saline, and basically what I use it for, in addition to flushing the paste, is to also cool down the burr, because the burr could get hot, especially if the bone is very strong, right? So I'm here right now, I'm about to finish the dorsal cut. This technique, actually, I'm gonna say the person that actually taught me the technique, and his technique is the Bunion King, right? He calls it the Mona Lisa. So it's a beautiful technique. It's basically a cut that goes 90 degrees plantarly and then 45 degrees from proximal to distal in the dorsal cut. Now at this point, I'm now pushing the metatarsal over, and I am done with the osteotomy. I'm just going over at that initial incision on the top to to basically file down any bony prominence that we might feel once we shift over the metatarsal. It looks very bloody, right? That's completely normal. We want that blood because we wanna. This blood allows the actual instrument to pull down as well. All right, so here you could tell that we did osteotomy and we shifted the bone over, and now the head looks in a very good position. You can tell the sesamoids is right under the metatarsal head. And now we're gonna go into the initial marking, which is we're gonna do the Aiken, the osteotomy on the first toe. Here, we don't make a through and through incision. Basically what we do is we take a wedge of that bone so that we could tilt the toe over. So we'll make an incision, take a wedge, and then just tilt the bone over. All right. Okay. All right. This patient in addition had an ingrown toenail, chronic ingrown toenail. Well, we saw at the end when she had a little exostosis that was still bothering her. So we made an incision on the lateral border of the nail, and then we filed down that bone spur. Now we're finally, at this point, we're closing up the site. You know, we flushed out all the bone paste, and we're using sutures to close our incisions. At times, the incision is small enough that we don't need to use a suture. However, with this one, though I made a small incision, I still use a suture to close down that surgical site. Next, we're gonna move on to the toes. For the most part, her toes were all normal. Just I don't know if you can tell, like the third toe is the one that's actually kind of being pulled down. So that's the one that we really worked on. We just made an incision on the bottom and lifted the toe. You'll see it in a few minutes. All right, so here we go. I'm making the plantar cut on the toe to release the pull of the flexor tendon, allowing the toe to come up. Okay, we're balancing the other ones too, but we're not doing a full incision, just a partial tenotomy to allow them to be more flexible and kind of sit in the same plane, right? Same incision poke. We use the C-arm. Initially, you just don't see it here to mark our place, and now with the bone burr, we're gonna make an osteotomy, through and through osteotomy on the 5th metatarsal. Here we're gonna start incision, and you can tell the bone is going. Like now we're going through the first cortex, and at this point we're still in the first. It's just two sides of the bone, so we're cutting into it, and now we already went through the other cortex, and now we're gonna go up and down to make our osteotomy. All right, so now we're flushing all the bone paste that's left over. Again, we're using sterile saline to flush all this out, and now we're done. So here, what we do is we're putting the dressing. The dressing is also 50% of the surgery, because what this dressing does is it externally fixates the osteotomies that we got, right? So it's very important to do this at this point. And you know, I use a little bit more padding on the side of the 5th metatarsal, because it normally is the one that gets irritated and it's more painful. All right. We're right through it. We're getting the dressing on. We overcorrected the toe. You can tell that the first toe is kind of shifting over, giving the patient initial peace sign, right? But it's not going to stay that way. We just do this to overcorrect it and make sure we keep everything level line. And that's it. You know, it's just putting on the dressing, keeping everything where we want it, and we're done. If you have any questions, please feel free, text them. And if you like what we're showing you, subscribe. Thank you. Have a good day.